Of head injury has advanced many ways. In the recent years, technology, supportive care, transportation, critical care, the surgery and the rehabilitation have brought many disabled peoples back into the original life. However, the death rate continues to be high. This is something very alarming that clearly shows we do not take precautions on the road, we do not provide support at the scene, we do not still have an effective transportation for these individuals. People do not know where to go. We need to have designated centers who will exclusively run 24/7 emergency, and as soon as the patient arrives, we should see that everything is done within first hour. That's called the golden hour. And in the golden hour, all investigations have to be completed. The CT scan from the entire body is preferable depending upon the severity of the injuries. If not, at least the brain and the cervical spine, including the face, is mandatory. The CT scan clearly tells if there is a skull fracture, the blood clot, the location of the blood clot, size of the blood clot, its effect on the brain, and other associated injuries, particularly the type of fractures, type of hematomas, spine injuries, and when the person has suspicion of a blood loss, hypotension or low blood pressure, shock, then we need to do the chest as well as the abdomen. The commonest source of bleeding is either into the chest cavity or into the abdominal cavity or into the pelvic cavity or on the fracture site, particularly in the long bones, or is there an external injury where the bleeding can be outside. So it is important that we need to control the bleeding as soon as the patient arrives into the emergency. Parallelly investigate and do the blood test, blood grouping, imaging of the entire body to identify the criticality, and based on the type of injuries, number of injuries, the priorities have to be identified, and it is always done through a trauma team where the casualty or emergency medical officer will be the leader who will coordinate and get all the investigations done, parallelly assessing the severity of the injury, importantly identifying the life-threatening injuries, same time making sure that airway, breathing and circulation is maintained, and based on the number of injuries, the most life-threatening injury have to be given priority. This includes a team of neurosurgeons, orthopedic surgeons, abdominal general surgeons, thoracic surgeons, plastic surgeons, maxillofacial surgeons, and vascular surgeons, depending upon the need. So depending upon the type of injury, the casualty medical officer should give a buzz to the team completely to evaluate their individual roles and then take the appropriate decisions. And based on the injuries, the respective surgeons will take the role to correct the damage.